This is BK. She is a 27-year-old African-American female. She presented to the psychiatric mental health nurse practitioner clinic with the complaint, "I know I'm depressed." She states she was energetic and happy while pregnant, but 4 months after her baby was born, the stress of having a new baby, school, and chores at home have triggered her depression. She states her depression has been intermittent for the past 10 years. She was on Prozac in the past, but stopped after 2 doses because she didn't feel comfortable with the diagnosis of depression. She admits to anhedonia, sleep disturbances, motor lethargy, suicidal thoughts but denies plan, inability to make decisions, decreased effectiveness, and crying episodes. Past medical history includes depression, asthma, and borderline personality disorder. She denies family history of psychiatric illnesses because she states people from where I'm from don't really look for help with that. BK is an ex-Marine and started school as pre-med while pregnant last year. She is a former smoker, and she does not drink alcohol or use any illicit or recreational drugs. Other than mild asthma as a child, she reports her overall health is good. Based on this first appointments assessment and breastfeeding status, KB was started on sertraline. 2 weeks later, she denies any side effects from the medication, and she reports she is taking it daily. 1 month later, she reports she is much better and everyone sees a big difference in my mood. 2 months after initially starting BK on sertraline, she states, "I've been shitty." She reports she had a mental breakdown because of not passing any classes. I threw my computer even. She states she has frequently been missing classes because of home stressors and inability to focus on her coursework. Even though I'm the smartest in the class, I just can't get the work done. She also admits to decreased appetite and insomnia. I stay up all night and have all the energy in the world to do stuff, I just can't get it done. She worries that her irritability is affecting her 8-month-old son. She admits to yelling at him at random for silly things such as making messes. Most recently, she nearly got into a fist fight with one of her peers for picking on me. She reports her husband had to hold her back as he was holding their son. Her mental status exam is as followed. Appearance is well-groomed, clean, and she is of normal weight. Her behavior is cooperative, calm, with good eye contact. Her speech is reciprocal, normal volume, but rapid and pressured. Her cognition is alert. Her memory is both remote and recent intact. Her mood is neutral and different. Her affect is anxious. Her insight is fair. Her judgment is poor. Her thought processes are circumstantial. Her thought content is unremarkable, appropriate to situation, and reality-based. She denies suicidal ideation, thoughts of self-harm, or homicidal ideation. She was asked if she knew why she was given the borderline personality disorder diagnosis in the past. She reports it was because she had episodes of cutting, times of being emo, and doing random things like shaving her head. She also reports because she was such an angry, irritable person for weeks to months at a time, she was told she had borderline personality disorder. She is diagnosed with bipolar II disorder with a NANDA diagnosis of risk for violence, self-directed or other directed. BK likely has had bipolar disorder since late teen years, when she first started to exhibit her irritable, impulsive, self-harm behaviors and was misdiagnosed as depressed and then with BPD. Each time she was cutting or self-harming, she was told it was depression. Each time she was impulsive, irritable, or had an identity crisis, she was told it was because she had BPD. She didn't know the signs or symptoms of borderline disorder because she reports no one in her family or neighborhood sought out or utilized psychiatric help. Reviewing the patient's most recent history, it is likely she was hypomanic while pregnant. She reported more energy and was very happy. Then progressively, after the baby was born, the hypomania went away and she became depressed. When she was given the SSRI without a mood stabilizer, it resulted in her becoming in the manic state she is in. The patient was instructed to stop the sertraline and start aripiprazole, 10 milligrams. The aripiprazole will help stabilize her mood and will help with her depression as well. It is FDA approved for bipolar disorder as well as major depression. CBC and CMP were ordered to get a baseline of her electrolytes, kidney and liver function, as well as her WBCs and H&H. A TSH, T3, and T4 were also ordered to ensure there was no secondary thyroid issues which could be causing her symptoms. Lastly, a lipid panel was ordered to get a baseline of her cholesterol. This patient would benefit from talk therapy, more specifically mentalizations-based therapy, MBT. MBT can help the patients identify and understand what others are feeling and thinking. Bell et al. 2012 reported that MBT is beneficial for bipolar and BPD patients. Additionally, yoga, exercise, and diet and meditation have shown to be good adjunctive treatments for bipolar but are not effective in place of pharmacological treatment. The husband and the patient were educated on bipolar disorder diagnosis. Similarities between BPD and BD were discussed, as well as treatment options available to her.